Professor Dr. Thomas Rau, thank you for accepting to explore your epic work, I think revolutionary work in the following 45 minutes. Since 1992, you are directing, medical director of the clinic that has been founded in 1958, Paracelsus Clinic.
Ați fondat clinica Paracelsus în 1958.
One of the most advanced in the field of research clinic.
Importante clinici în domeniul cercetării medicale.
As I understand, there are up to 100 persons, staff of the clinic, up to 300 patients per day.
Din câte știu,
A remarkable building, and then a hotel, when the patients can be accommodated and learn a new style of life within 2 or 3 weeks. A common question would be, how come that your life lead you to those important outcomes, which, as I see it, they are revolutionary and I think quite very sometimes hard to be accepted in orthodox mainstream science.
Well, thank you very much for inviting. So I jump into the answer. You know, I am also Orthodox doctor. I was trained as an internist, as a rheumatologist, and so I was confronted with the normal medicine. But honestly, on these difficult cases, we were not successful, which is still the case. Orthodox medicine did not really change in the last 30 years, except that they found the antibody treatments, which is something new. But all the other things are more or less the same as they have been. But on the other side, there are more and more there are diagnoses or diseases which are undefinable. The so-called undefinable diseases, UDD they are called, they are very frequent and they become more and more a social, an economic, a medical impact to the community, to the society. I think about chronic fatigue, adrenal insufficiency. I think about autistic children. I think about cancer. The success in cancer treatment did not change in the last 40 years. Even though the costs of cancer treatment gets exploding. If you are not only, how do you say, stuck in your mind, you have to think about where are the faults, what is wrong. Should we perhaps access from a different side to the question of healing? And I don't see it from a psychological side. I see it from a cellular side. Why do organs get sick? We say organs get sick because the whole body system is sick.
So it's a systemical approach?
It's always a systemical approach. I never treat diagnosis, I always treat the whole human being.
So you are not a Cartesian practitioner, which always try to cut in piece the reality in order to control it. You succeed to have a holistic view, but it's not so simple. And then it's take courage. I was thinking about the fact that you refuse to remain stuck in the conditions that Orthodox medicine are offering to the population.
How can I, you know, once I was wearing the oath for helping my patients, and how can I fulfill this obligation if I run in a system which is not working? So I have to do something else, and we have to be open. Medicine, nowadays medicine, and I'm also a medical doctor, so nowadays medicine is sick from the specialization. This is the wrongest what can happen. This, what you say, this Cartesian tendency of cutting. You have specialists, you have subspecialists, and they do things which are against the other organs, and so on.
It's counterintuitive, in fact, and have the opposite effect, this kind of development in science in general, but in medicine in special. So I think what you are offering now, it's the very needed and compensatory movement in the field in order to put again the pieces together.
Yes.
Yes.
We have a lot of counteracting from the pharmaceutical world, from the medical world, medical society world, because they do not really want to change.
Lots of money there, an industry.
Exactly, and it's such a huge movement into this specialization and into guideline medicine. And guidelines are always wrong for the individual. Guidelines may be for a big population, but not for the individual. So we need to come back to individualization of the medicine. And I'm extremely practical person. So you asked me before, or you mentioned, how can it be that you grew so much? Well, it came because I just integrated. I do a lot of teaching. I got colleagues who were enthusiastic too, so we grew to a team of around 10 doctors and of a staff of 110. Now we reduced again last year. We reduced significantly because we had a change of owner of the clinic, and now we are on about 60 staff. We are on 6 doctors. So we have 6 doctors, we have 3 dentists, and per day we treat around 200 patients per day. But this is not so impressive. Impressive is what we treat. We have nearly only very difficult cases, rare cases. Most of my patients, they had done many treatments, orthodox treatments. They did already specialization treatments, and they come because they are unsuccessful. So in a way, I have a very negative selection of patients. I have the bad cases. And still, and they come from all over the world. In 2017, we had patients from 82 countries. So they fly very far, they have a big story, they have loads of documents, they have been in all the clinics, Mayo Clinic, Bangkok Clinic, and so on. And still, they are as sick as they were before. In average, my patients have 9 orthodox medical. In average, we have such with 20, we have such with 5, but in average, my patients have 9 different orthodox remedies. And they even counteract. They have AC inhibitors, and they have, for prostate, they have alpha stimulators. or they have beta blockers, and they counteract even. So they suffer a lot on side effects too. And the real disease is not getting better. So it's on cancer, on autoimmune disease, on neurological diseases, which increases in number significantly.
And
80% of my patients, they come back. Of the overseas patients, 80%, even though it's quite expensive, it's a big effort for them to come from Brazil or from Israel or from China. They come and they come back because they feel, oops, it works.
So this means that the healing rate is impressive comparing to mainstream treatments.
The healing rate of my patients is absolutely impressive, because before they had no healing, otherwise they wouldn't come to me. So, and what am I doing? I do a very strict program. The very strict program includes the causes. We look for the causes for their disease. There is no idiopathic disease, disease of unknown cause. No, the Orthodox people, they just do not look for the cause. This is why they don't find it. So, and we look for causes. And when I see on my patients, this is thousands of patients per year who come to our clinic, and when we look, we do the testing, we find toxicity, we find sincere metabolic suppression, mainly due to the intestinal situation, and we find a lack of upbuilding or rebuilding forces. The body should rebuild itself, but on our patients this rebuilding is slower or less than the downgrading. So they suffer on this degenerative tendency. And we inverse this degenerative tendency.
Your research can offer to the whole world the dimension of prevention also. What to do in order not to arrive in those heart conditions. So this is also, I think, in your books, kind of healthy prevention dimension, which is very important. Can you, so for all the people that are listening looking to you in this moment, what it's to be done in order to make a change in their lifestyle or their health?
I can just tell out of experience. When I look at my patients, what is really helping them, all these difficult patients, really helping them the most. And in my experience is this acid-base metabolism. So they are hyperacid, which makes an increased degenerative tendency. Number one. Secondly, they are toxically loaded. And the toxic load got at least 10 times higher even since 1980. So we are in an increasing toxic and also increasing electromagnetic load environment.
Can you tell us a little bit about the toxic factors? For example, the amalgam, from the dental amalgam, which contains mercury. It's one of them, but heavy metals, but from where?
Yes. The heavy metals the heavy metals are the most important toxic loads. And it increases. We work together with the highest reputation toxicological institute, and they say it constantly increases the toxic load on our patients. And orthodox medicine does nothing against. And the toxic load causes cancer, causes autoimmune diseases, causes metabolic diseases, causes a lack of important trace elements. So that's why we analyze all our patients. I do just all the modern toxic evaluations. So, which is not some dream world. No, it's materialistic toxic evaluation. And we find heavy metals and we find organic toxins. Well, anorganic and organic toxins. The anorganic toxins, they are now, it always changes slightly, but the situation today is mercury, cadmium, arsenic and aluminium. These are the most frequent toxic loads. And they are all cancerogenic and they are neurotropic. This means these loads, which increase in average population, makes neurological diseases. I asked the professor of toxicology in the University of Basel, it's the Pope of toxicology, I asked him, Professor Kruslin, what do the neurological clinics find in their patients? He says, Dr. Rao, you are the only one in Switzerland who tests. So who is scientific here? The ignorance, they tell me I'm not scientific because I do biological medicine. But they not even test for the causes of their disease. And they say they are scientific. Strange world. So, our medicine is the medicine of future, because it goes to the causes of the disease. And it has a solution. My patients prove that we have a solution. And it's not one patient of whatever. No, we have hundreds of patients.
Can you tell us maybe a resume of one case which impressed you the most and which seems to be a kind of miracle? If we consider it his way of healing, the specialist that he has been seeing and so on, come to you as the last chance?
We have a lot of young persons nowadays. Young, well, even children, neurological children, they get more and more frequent. And we have a lot of autistic children. Autism, it gets so extremely frequent. In the United States, in bigger towns, they have a percentage which is up to 5% of the school children have autistic symptoms or even the clear diagnosis.
And this tendency will increase?
This tendency is dramatically increasing. Of course I have cases, I could show this case or this case. But then the counter-argument comes, every doctor has a good case.
Of course. Yes.
This does not prove that I'm right when I have one good case. But send 20 autistic children to me. I would say in 12 to 15 of these patients we have a significant success, and they did not have any success before.
Measurable success.
Measurable, yes. They change their behavior, they change their cognitive capacity, they change their social skills. So it is a change in their clinical appearance. Not in all, but in many. And all of them come as hopeless cases. We only have the hopeless cases. The other ones, they don't come from Malaysia to us, or from Brazil to us, or from wherever. So they come because they are the hopeless ones. Would they come back if we wouldn't have success? No, 80% of my patients, they come back all the time from all over the world. This proves the success. And we also have this is on the other side of the of the lifespan, we have cancer stage 4, terminal cancer patients. For example, the case I just presented to the seminar, a lady with pleural mesothelioma, which is the most malignant lung cancer which exists. She was told, 80 years old, or 79 at this moment, she was told, clear your life and make the testimonial and we can't do anything. We can give chemotherapy, but it doesn't work. They even told her, but you have a life expectancy of half a year. And now it's 2 years since. She called me, Dr. Rao, I can't come to the control. What? You don't come to the control? Why? I thought she's very sick because she lives in part-time in Spain. No, I stay longer in Spain because it's so beautiful. I can swim in the ocean every day. But it's 2.5 years since she was diagnosed. And it was told, you have half a year. So, and we have not pleural mesothelioma cases, they are rare, but we have many breast cancer, many colon cancer, we have many lung cancer. When you look at lung cancer, it is known in China, you know, China, Beijing has good statistics on lung cancer. It's the town with a exploding lung cancer incidence, Beijing, in China. So, and they know lung cancer comes together with cadmium load. And in winter time, they have this charcoal, this coal burning cadmium load in the smoke. When you go to, I have been several times in Beijing, when you go there in winter time, you can hardly breathe because you have this very sharp smoke which irritates. It contains cadmium because they burn. Still, all the heating is on coal, and they have a load of cadmium. This makes lung cancer.
Professor,
but nobody does anything. But you can, yes, I can't understand why do they not treat cadmium? Why don't they look? You asked before for prevention. You would come to me and you would ask, am I a cancer candidate? What can I do? As an example. Or am I a candidate for heart infarction or for brain stroke? But you go to a doctor for cholesterol, perhaps he makes an MRI of the brain and he says, oh, you need cholesterol tablets and the brain is okay. But this doesn't show anything about the risk. The real risk comes when your inner milieu is not intact and when you are toxically loaded. So we look for these things and we have tests which tell me what to do that in 5 years you are not getting sick.
So this means that education for detoxification, it can be a plan, a national plan for, I don't know, in the future, or the detoxification has to be done in a very particular way. So, for example, shall you recommend to the common people, for example, to fast or to take one of the remedies that you are using, something like this?
Yes. I can tell you, if you are, or
yes,
everybody, what kind of toxic load you have, because we have...
First we have to find this, what kind
yes,
of toxic.
and then I can do very individualized, I can do the cleaning. We call it cleaning or draining of toxins.
Yes, otherwise general cleaning, it's...
of course it can be done. I was asked by our marketing guy, this is so interesting what you say, but it's too complicated. I can't do any marketing for you if you come across so complicated, he said, the marketing guy. And he said, you have to have three things. I can only market 3 points. And this let me think, because he's right. We need simple things which are effective.
Understandable and available.
Understandable, available, cheap, and also doing by the practitioner in Delhi or in Bangkok or in New York. So, or even teachable to the population. Today I will have a public talk tonight, and I will talk about what can you do. Well, you can change the nutrition, you can do detoxification by drinking, by taking algae, chlorella, that's very cheap, as an example, or taking charcoal, as former times people did, or taking some supplements which are available in every country, like selenium. Yeah? European population has a lack of selenium. Lack of selenium is one factor which leads to cancer, especially breast cancer. And you can build up your intestinal system, which is the biggest detoxifier, you can build up by changing diet. It's very simple.
The Swiss secret to optimal health.
The Swiss secret to optimal health.
This can be found on Amazon, for example.
Yes, all the books are found on Amazon, and it's very simple. It's sold about 50,000 times. I have no idea who bought. No idea. Probably one tells it to the next and they buy and it just sells. Because it's simple and you can do it. It's a change of nutrition. I have a program of 1 week or 3 weeks, intensive if you want, an intensive nutritional program.
Can you give us just one principle of the nutritional changes we have to?
Well, it's some little points, the principal points. No cow dairy product and no sugar. All what contains white sugar is forbidden, at least for this intensive program. And no cow milk, because cow milk, today's cow milk products, they suppress the T cells, the immune system.
Goat milk?
Goat milk is much better and sheep milk is also much better. But still not in big quantities. And milk is not a drink. Milk is a concentrated food and is not good for the organism because it has a wrong combination of proteins. That's too much into the details. So, eat vegetarian or closer to vegetarian, eat a lot of vegetables and don't take any cow dairy product and no sugar. This is the very simple thing.
And then the fish. I understand that they contain heavy metals.
Yes. It depends from where the fish comes. If they come from an area where a lot of rivers go in and they are very toxic, then of course the fish are toxic too.
So this is another thing in education, to know what regions from the globe are toxic and from where.
Yes, and what food has more toxic load and what has less. But this is written in the book. Yes. And we do, in my clinic, we do a lot of training for the patients. When they come, they get a nutritional and a lifestyle training so that they can continue. I tell the patient, you are the doctor, not me. I only tell you how to do.
A healthy person can come in order to improve his or her life in your clinic.
Of course, everybody can come. I love healthy patients, but then we do the testing and I can tell you what can you do that you stay healthy. Yes. You know, sometimes they are still healthy because they are still compensating. It's like the pond is nearly full, but it does not yet overflow. But nearly full is dangerous. And I can test this. So we have a check-up program. Check-up program which goes 3 days.
Is it affordable for the, I don't know, common European citizen, financially speaking, to try? Of course, but because I found it very important in order to see your toxic load. I think here in Bucharest, quasi nobody think about it. So it is affordable.
Yeah. Well, my clinic for Romanians, they would say it's not cheap because we have different prices, but in numbers, if you come for a checkup, it's around 2,000 euro, including these 3 days, and we do all the testing. Including the testing. Testing is expensive, not the stay. It's not so expensive. So, but the tests are quite expensive. These intestinal test, the bacteria test, then all the toxic test for heavy metals and organic toxins, they are quite expensive. 2,000.
But see, this is the core of the improvement, because you know from where to start.
Exactly.
And after this,
after that, they can do most of the things they can do at home. They don't stay in our clinic. The ones who stay, they are the very sick patients. You know, the cancer stage 4,
yes.
or the autoimmune, or the multiple sclerosis.
So,
we have very good treatment on Parkinson's and multiple sclerosis. But they have to stay 3 weeks, 2 to 3 weeks, because then we can change the metabolism.
But a healthy person can stay until the tests are made, and then he can go home with
Of course.
with a set of things that he or she may do.
Yes, they get a nutritional program which is fit to this person, individualized. Yes. We test for food allergies, we test for the intestines. I didn't talk about the food allergies yet. We test for this, and we can tell the patients this and this and this you should not eat, this and this is good for you.
I think this is a life investment to come to your clinic as still your health, and you can compensate.
Yes. I have a dear colleague of mine in New Delhi. New Delhi. He's a German doctor, and he has his practice there because that's personal reasons why he got to Delhi as practitioner. And his patients, they don't have money. The Indians, the normal Indians, they don't have much money. So he does a very simple Dr. Rao's program. He gives this and these plants, the detoxification things, and he has orthopedic practice. But he says, since I do your simple upbuilding and detoxification program, my patients have no more pain. The joints get better, they walk better, and I have bigger success than ever, even though the program is so simple and cheap for these Indian people. So it's not a question of only millionaires can do it. Absolutely not.
So what we may witness now on the global level in the health industry, is it, from your perspective, a matter of ignorance or matter of, I don't know, interests, financial interests and so on? Is it a kind of conspiracy theory that you can see that works, or is it pure ignorance?
You know, in public talks I don't like to speak about conspiracy.
It's a kind of paranoid stuff, of course.
But I think it's a mixture. There is the system of medicine nowadays is no more the right system. The specialization. And in this specialization there are thousands of little interests. And the specialists in this sick system, they still have a very good living. So they do not want to change much. It's the idealists who are honest enough to say, oops, we are not so effective, we have to change something. Like this Indian German doctor. So, and there is a big interest. The pharmaceutical interest is huge. So, and I think the system supports the pharmaceutical system. The specialization that the practitioners who were treating the whole patient, even the whole family, they have no more importance nowadays. But it's also the patients who demand. The patients are brainwashed also. Most of the patients, they still believe in the specialists. They still believe in orthodox medicine. It's a mixture. I don't blame this or this.
I see in you a builder, a constructor, so you are not the person to destroy or to be aggressive with anyone. You are a person who support life, not conflict. And we may see this is remarkable, I think.
I never polarized. I did my medicine. I'm super strict. I tell my patients, it's your decision if you want to follow my medicine, but if you follow, you really follow. I do not make compromise. And this is why I have so many patients. The ones, they want to integrate themselves in healing, they want a strict doctor, a clear system.
A structure, a very clear structure. Maybe our last question about how do you see the future? So the toxic load, for example, electromagnetic load, will increase. Now they're speaking about the 5G effect, and so on. So there's not such many lights in the future as it is with our technological advance and so on. How do you see the next 30 years in the field of the health?
If we look back the last 30 years to 1990 or even 1980, the change in health and load of the patient increased like this. And there is absolutely no sign that it goes back. Absolutely no sign. It will probably even increase more.
Exponentially.
Yes, exponentially. And when we see the social health system, the general health system, it's like a pond and the disaster is very close. I'm sure that if it continues this way, it will come to really bad situation. Because look at China. China is a good experiment field. I'm a lot in China because our owners, the clinic owners, they are Chinese. And so I have the chance to go there to China. And diseases explode in the big towns. And the diseases, they come from toxic load, wrong nutrition, of course psychological stress too, and electromagnetic load. So this mixture which we have, lifestyle, nutrition, electromagnetic load and toxicity, leads to a health disaster.
So those four factors are working together. It's very hard to say which is more important, or
I can't say. I can't say which is more important. It's really the mixture. But I'm shocked about how much we read about climate and and the warming of the earth and all these things, which have such an importance. And toxic load and malnutrition, which has such an importance. We should more concentrate on the important things.
Yes. Thank you, Professor Dr. Thomas Relo, for allowing this to happen, and we are hardly waiting to see your public talk about what is to be done in order to be healthy.
Thank you very much for the interview.
Thank you again.
Fii sănătoși.